Hello, DK.
Hi, Prem. How are you?
Fine, thank you. I'm just waiting on a slide to upload.
Oh, great. But how
I'll give it to Duncan.
Have our people joined?
Yes.
52. Yeah. Sorry? Okay. Well, Prem, what we can do is I can start and we start the introductions.
Yes.
Can everybody hear us?
Yes, I can hear you well.
And the people from the Bora community, can you hear us? Right, yes. Okay. In which case, then we can actually start.
Yes.
I want to introduce this meeting as our very first meeting with our neighboring community to discuss things that are mutually of interest to us, both at current hospital and the Bora community and the university and the hospital, so that we can both share knowledge and experiences together. This is a presentation by the current hospital, in which we shall have 4 of our current hospital senior staff participating in this discussion. That includes me, Dr. Dan Gikonyo. I'm the cardiologist at one of the cardiologists at the current hospital, and also our founder. There is also Dr. Premod Ponoth, who is our chief cardiovascular surgeon. We are also participate in this session and give us some views of cardiac surgery and COVID. We shall also have Dr. Sakina, who is one of our senior medical officers. We will talk generally about medical issues. And I was hoping that Dr. Shango Irongo, she's on. I'll call her so she can start. We also talk about our experiences. So we should proceed, because I would like us to have as much time to ask questions as much as possible, more than us giving a formal lecture, but we shall just give introductions and then allow questions. Are you saying that they cannot ask questions? And for our participants, we appreciate even as we speak, you can actually type in questions that we can then answer on our platform. Our topic for today, we are going to discuss the current epidemic of COVID and see how it interacts or is related to lifestyle diseases that we often meet in our day-to-day practice. As I say, my name is Dr. Dan Gikonyo. I'm a cardiologist at the current hospital. Formerly, I was a lecturer at the University of Nairobi Medical School. Current hospital is now in its 14th year. The hospital was opened in the year 2006 by our third president, Honorable Mwai Kibaki. As you can see him there, cutting the tape. Next to him on the right here is Dr. Betty Gikonyo, who is a current chairman of the current hospital group. She's in her own right a pediatric cardiologist. Current hospital is actually a system. Many of us may know about the current hospital as an institution that is located on the current road, but we are more than one hospital. The hospital is the hub or the main center of our current health system. We do run a number of other functions. We do have a current hospital medical training college where we train nurses and clinical officers in cardiovascular technology. We also are an internship center where doctors from the various medical schools come for 1 year of internship prior to their registration. We do also receive physicians who have qualified from the other universities with a postgraduate degree in internal medicine, and they come for 1 year where they practice here, and before they are licensed and registered by the medical board as fully fledged physicians. We are starting training for surgeons in association with the East Central Southern African College of Surgeons, where we are training surgeons as from this coming year. Apart from the training school, we do have a Heart Foundation, which is our corporate responsibility arm, where we actually offer heart surgery for children with heart diseases who cannot afford to meet the cost of the surgery. And the Heart Foundation now started in 1992, and over those close to 20 to 30 years, we have been able to help over 500 children with heart diseases who come and they undergo surgery and care at our hospital without paying any medical fees. We raise our funds in various ways by being helped by corporates like yours, banks and other people who are friends of the Heart Foundation. We fundraise through our annual Heart Walk, which we didn't do this year because of COVID, but we do hope that we shall do it coming year in March, April. The current hospital has, in addition, various other branches. We call them satellite stations, where we do have outpatient services for patients that include both clinical services, echocardiography, electrocardiography, pharmacies, laboratories, physiotherapy, etc. And we have 8 currently functioning satellites, 1 in Nakuru, and in Naivasha. We have 1 in Meru, in Thika, main in downtown, in the Cardinal Tuga building. We have 1 in Rongai, and the main hospital. All these are small satellites. They are like small clinics, but they have full functioning facilities of pharmacy, X-ray, laboratory, cardiography, electrocardiography, and clinical services run by 1 or 2 doctors and attending nurse. I'm mentioning this because some of our listeners may be in those other areas like Nyeri or Nakuru or Naivasha or Meru, and you may want to access our services. All these clinics are interlinked by internet, and we can do all things together. At our main hospital, we do have a 24-hour accident and emergency unit, which is run by competent medical officers. We do run a vaccination and travel medicine center. In our imaging section, we have multi-slice CT scan, X-rays, mammograms, ultrasounds. We have a 24-hour laboratory and a 24-hour pharmacy, physiotherapy, and hydropool. We have the heart clinic, which is the heart of the whole business, where we run a lot of cardiac investigations, including ECGs, echoes, exercise stress tests, head-up tilt tables, 24-hour Holter recordings, and many other basic heart tests. We have a cardiac rehabilitation center for patients who have had myocardial infarctions, heart attacks, and for people who have undergone heart surgery. Our cardiac catheterization laboratory is fully functional, where we do most of the diagnostic and interventional cardiac work. We can do angiograms, we do angioplasties, and other interventions, both in the in the coronary and the cardiovascular area, including the aorta, where we do a repair of aortic aneurysms from intravascular approach. We have a day surgery, a dental unit, a video endoscopy, a main theater, wards, maternity services, and other facilities. This just let us, all of our participants, know that we are fully functional 24 hours and we can partner with any other group in the services. Our topic for today is COVID-19, which is a pandemic now ravaging the whole world. Luckily, Africa, and specifically Kenya, we have not been very hard hit, and we have been blessed by the good Lord not to have the same problems like the rest of the world has had. To date, in Kenya, we have had about 96,000 cases diagnosed, of which luckily 77,000, more than 3/4, have recovered by now. And we have lost only 1,600 people. This, I say, is a blessing to Kenya, because the whole world, there has been over 82 million cases with 1.79 million deaths. And for us, the 1,000 is a small percentage of the total world death. This is maybe from God's grace, but also from other factors, including genetics, young population, the sunshine that gives us out of vitamin D, and maybe just God's blessing. The COVID-19 virus is a very interesting virus because it enters the body through the respiratory system as we breathe it in. And once it gets into the body, it enters through the lung into the blood system. It is there where it attaches with our body cells through a receptor called the angiotensin receptor 2. These receptors vary from one person to the next, and they also vary from one particular group of people to others. That's why the severity of the disease varies from one person to the next. These receptors are more in people with cardiovascular disease. They are more in people with inflammatory diseases, and that's why those people are more at risk of getting complications of the COVID infection. The COVID virus sets up in the body a systemic inflammatory response that is no longer located in the lungs, but goes to all parts of the body. It causes a rise in temperature, an increase in heart rate, an increase in breathing rate, a reduction in the amount of oxygen in the body, a rise in white cell counts, and all these conditions called the systemic inflammatory response are the ones that cause the pathology or the disease as we know it, damaging the lungs, damaging the heart, the kidneys, the nerves, the brain, the digestive system, and all parts of the body, such that although the virus just enters the body as a virus through the lung, the damage is not only in the lungs, but all over the body. The damage in the lung is the starting point, and we can give you an example of a matchbox that you can use to light a fire. The matchbox is very small, and you can strike it, and you get a very tiny amount of fire. But if it catches dry wood and forest, it can spread to become a big conflagration that can consume houses and towns and big trees. This is what the virus does. It enters the body through the lungs as a small virus, but then it causes extensive inflammation in all the organs through the blood vessels. And that's why people die from this disease, not just from the lung damage itself, but from damage to the heart and other organs, as other speakers are going to tell us. Who is at risk? Those of us who are over 60, but you can do nothing about because age just keeps on increasing. People who are overweight are at risk, and therefore it's very important that we reduce our body weight because this is a protection against the COVID virus infection. People who have high blood pressure, hypertension, diabetes, kidney disease, cancer, HIV, TB are also at high risk of dying from COVID if they get infected. As you can see on this slide, if you have no pre-existing condition, and if you're young, maybe a teenager, the chance of dying from COVID is less than 1%. But if you are older and you have cardiovascular disease or diabetes or lung disease, hypertension, cancer, the risk of dying goes up to 5 to 6 to 7, up to 10. The more of the risk factors you have, the higher the risk of dying from COVID. But see that even at the highest level, mortality is only 10%. Although it becomes an issue because of numbers, the mortality is 10%, even in the very high risk group. There have been other flus in the past that have come and gone. The most important one was the Spanish flu of 1918 to 1920. It took 2 years that killed over 50 million people in the world. So far, as we saw earlier in the slide, only about 1 million people have died from COVID this time. But in 1918, 100 years ago, 50 million people died worldwide. And maybe there were more because statistics those days were difficult to keep. But it came and it went and the world moved on. So even this epidemic will come and will go and the world will still move on. The important thing about this talk is to know who is at risk of having complications from COVID. It's people with heart attacks, diabetes, HIV, and people with chronic respiratory disease. These are all lifestyle diseases that we can modify. Cardiovascular disease remains the major leading cause of death in the world. 85% of all the disease burden in the world is from cardiovascular disease. And these non-communicable diseases are responsible for almost 60% of the world deaths and 40% of the total global burden of disease. Today, we shall focus more on the heart because that's what we are going to talk about more. And we shall focus on the circulation in the heart. There are 2 little vessels that you can see on this diagram called the coronary vessels. Dr. Prem will tell us more about how to manage coronary artery disease, which we know is a progressive disease of occlusion of the blood vessels because of laying down of blood clots and plaques of cholesterol in the vessels. It is when the vessel finally becomes occluded or closes that blood is cut off from the rest of the part where the vessel is going and you get a heart attack. And this is something that's very common these days. And I want to mention that it is becoming very common, but we at the current hospital are adept and very well trained to take care of cardiovascular diseases, including heart attacks and including cardiac surgery and other vascular areas like veins, like one of our doctors will discuss after I'm done. This shows you the progression of atherosclerosis or the blockage of vessels as we get older. This is a diagram showing first 10 years, second 10 years, third 10 years, the fourth, until you get to the 7th decade here. As we get older, our vessels are no longer clean on the inside and smooth like this one. They become rougher by deposition of cholesterol and other things into it. Eventually, they close. And as they close in particular organs, that's the time you get problems. In the brain, if the vessel closes, you get what we call a stroke or a cerebral infarction. In the heart, you get a heart attack or a myocardial infarction. In the kidney, you get kidney failure. In the legs, you get poor circulation with the loss of circulation in the limbs, leading to limb loss. Because the Bora community is just next door to us, we'd like to tell you that we have a 24-hour system that takes care of heart attacks. And if you get a chest pain that is similar to the one that you get in heart attack, please feel free to come to us any time of the day or night. And that is, if you get a chest pain that comes when you are walking and goes away when you stop, or you get a chest pain that is so excruciating that you start sweating, you become short of breath, please know that you could be having a heart attack. And if you can't drive to our hospital, call us, we have an ambulance, and we can come and pick you. And make sure that you get to hospital before 6 hours because this is the golden time that we can be able to open those vessels with either angioplasty or thrombolysis with medications. If you get that type of pain and you have the risk factors and give heart attacks, please take an aspirin as you wait to be collected by the ambulance. We know people who get heart attacks are people who have been smoking cigarettes, and I hope anybody listening today is not smoking, and if you are, that you are going to stop immediately. People with a high cholesterol, high blood pressure, diabetes, excess body weight, lack of exercise, and people who have a family history of heart disease. These are the people who have a high risk of getting cardiovascular disease. And cardiovascular disease, as we have seen, puts you at high risk of having complications and even of dying from COVID infection. You can tell how healthy you are by measuring your waist circumference at the level of the umbilicus. And for men, we want you to be less than 102 centimeters at the level of the umbilicus, or 40 inches. For women, 88 centimeters or less than 35 inches. So you can take a tape measure right now as you are listening and measure your circumference of your tummy at the level of the umbilicus. If you are more than 40 inches or more than 102 centimeters as a man, you are obese. You have excess body weight. If you are a woman, if you are more than 35 inches or more than 88 centimeters, then we know that you are also obese and you need to lose weight, because weight is a major risk factor for complications of COVID. There are other things we can measure, like blood pressure and blood sugar, that tells you what risk you are running. Diabetes is a very common disease, and this is something that we can teach our community to monitor ourselves, and we can do that by being able to buy a simple glucometer that can check your blood sugar. There are two types of diabetes, as you know. Type 1, which occurs in children, which is dependent on damage to the pancreas, and this requires insulin treatment all the time. Type 2, which is the one that's more common, occurs in adults, occurs in people who are overweight, and people who are sedentary, and people who consume a lot of calories. And therefore, diet becomes a major issue in managing of diabetes, and also physical exercise. Most of the complications we see in the vascular bed are from diabetes. 75% of all people undergoing dialysis in our country have diabetes. Diabetes is the leading cause of amputations, eye blindness, heart attacks, and strokes in our community. And diabetes is a lifestyle disease to a large extent, and can either be prevented or controlled by lifestyle, by exercise, by diet, by reducing weight, and following the doctor's instructions on how to take your medications. Cigarette smoking damages the lungs, and lung disease increases the risk of dying from COVID. So I do hope that anybody listening either does not smoke, and if you do, please, you have stopped as we finish this discussion. The risks of cigarette smoking are very well known, and they are dangerous as they cause heart disease, coronary disease, they cause lung cancer, people die early, it increases the risk of complications of hypertension, it increases the complication of peripheral artery disease, and causes impotence and infertility, especially in men. Weight, body weight is something that we can do something about by dieting and exercising, and we can help you at the current hospital to tell you how you can reduce your weight. We call somebody obese if they have a body mass index of more than 30. Body mass index is calculated by taking your weight in kilograms and dividing it by your height in meters squared. And we expect normal people to have a BMI of 18 to 24. If you get to 30, you're obese, and you need to do something about it because of the various complications that comes with it. Most of people who are overweight is because of eating the wrong stuff, and this is the easier thing that people are eating now in town, a little bit of chips, the hamburger, and maybe some soda, some Coca-Cola next to it. All those are things that you should avoid and teach our children to avoid all the time. We do have a wellness and preventive medicine department at the current hospital, and you can walk in and we can screen and tell you the risk you have, not only for COVID, but for cardiovascular disease. We assess the risk that you have by doing a physical examination and taking a good history, checking your nutritional habits, and then we target the screening to particular things that we find in your history and physical examination. We also do a dental screening and eye check that we advise all of our listeners today to do at least once a year, including checking for cervical cancer with a pap smear, checking for ovarian cancer with a blood test, checking for gastric and colorectal cancer by endoscopy and colonoscopy, avoiding cigarette smoking to avoid lung cancer. For men to have a prostatic specific antigen checked every year if you are over the age of 45, and maybe an ultrasound to check on the size of the prostate. We advise people to take immunizations. For people who are at risk of cardiovascular disease, to take a pneumococcal vaccine and a flu vaccine. The hepatitis B vaccine is for specific groups, and HPV vaccination is for young girls. And you can walk in at any time to our department, and we can organize for a full platinum checkup for you once a year to assess your risk of cardiovascular disease and therefore reduce not only the complications of cardiovascular disease, but the risk of having complications and death from COVID. And at this level, I'm going to ask one of our partners also here in the hospital, one of our senior people, to also share their view and opinions on how we can handle COVID in cardiovascular disease, in venous diseases, and in general health. And Dr. Prem Panoth is our cardiovascular surgeon who has done many cardiac surgeries in this hospital that people don't even know. He has done many coronary artery bypass surgeries with a beating heart, and he can now tell us more about himself and what he does and coronary artery disease.
Sure.
Welcome, Dr. Prem.
Thank you, DK. I think you have given
the questions. The questions will all come at the end, so that you can just keep jotting them down, and we shall have time at the end to answer all the questions when all the speakers.
Thank you, DK. Thank you. I think you have made my life very easy. You have given a very nice, elaborate way of explaining what we do at Karen, so that it is an eye opener for the community who are next door neighbors to us. I'm just waiting for my slide to upload. Duncan is supposed to do it. I think once it is done, then I can go on. So it's a pleasure for me to talk to the community. I have not made it very elaborate because it's a very big subject which we can talk for days and days. But I've just, since Dr. Gikonio has explained the basic problem of COVID, so I'll just go along. So basically what Dr. Gikonio has told is that it is an inflammatory process. It is an inflammatory process, COVID, which gets in through your lungs and then gets into the blood and goes all over the body. So as I told, it does cause inflammation of the heart. So if you do a surgery for these patients who are COVID positive, it has been studied by different, I'm quoting one of those European studies by which they told that the mortality is around 23 to 25%, 30-day mortality, which is very high. As you know, throughout the world and also in Karen, usually when you do a surgery, the risk is much less. But here, what you find is that the risk is going to be high. So we have made a protocol by which we check all the patients who come for surgery to do the COVID clearance before we do the surgery. It so happened that 2 of our patients who came for surgery, we had to send them back because they became COVID positive, treated. After 2 to 3 weeks, they came back, we did the surgery, and then they went back. So I think we are playing it very safe, as you know. Now, what happens is that uh, when the COVID patients naturally, if you do a surgery, the inflammatory process is triggered. As you know, when you stop the heart, when you do surgery inside the heart, you have to stop the heart, and we, with the help of a heart lung machine, we do the surgery. So the blood is taken from the heart onto the machine and brought it back. So when the blood is exposed to uh, tubes which are not does not have a lining, it triggers an inflammatory process. So much so that the morbidity and mortality goes up, and that's why we are very careful about it. Um, Next slide. How do we change to next? Yeah, thank you. So I'm just showing. Basically, this is what we do. As you know, any other place like Karen, we have the social distancing, hand sanitizer, mask, PPE, and all sort of precaution is taken. Due diligence is taken so that we take the maximum protection. And all the patients who are coming for surgery will be subjected for a COVID test, and it made negative. It is confirmed to be negative before we proceed with it. Second thing, we avoid unnecessary. Go to the previous one, Duncan. Unnecessary, elective surgeries, because as you know that procedures like aerosol generated procedures, for example, the endoscopies, especially the gastroscopies, those are the things which are the procedures which can create more chances for infection. So ideally, it is better if it is not essential, it is better to delay these procedures. And also, as you know, the in-house training is very important. It is the caregivers, the first line of duty people are more prone to these infections. So we keep in, not only protect them, but also give them proper education so that they have to be reminded that even though they don't have it, they can get it unless we are careful. So I just wanted to next, let me see the next one. Go to the next one, Duncan. So I just want to tell you, so when this blood is taken from the heart and it goes to the Duncan, next one. Can you get the next one? Somehow I'm not. Yeah, that's good. So what Dr. Gikonio has told, to reduce the inflammatory process, we try to do good number of heart surgery, especially the bypass surgery on a beating heart. What I meant to say is that when the heart is beating without taking the blood out of the heart, we do the procedures on a beating heart. It is known as off pump coronary artery surgery, or sometimes we call OPCABG. Probably we are proud to say that we are the only ones in East Africa, if I remember correctly, doing this procedure. So it makes it very simple. The blood transfusion is less, anesthesia time is less. Patient gets out of the ICU in 24 hours and goes home in 5 days. So it's good for the patient, good for the hospital. The As you know, when you do these surgeries on a bypass machine, many times it triggers the inflammatory process. The anesthesia time is more, the expenses are more, the blood transfusion is more. So it becomes more complicated. So we try to make it very simple and straightforward so that we can get the thing done at a much simpler way. So we try to do more and more patients. In fact, we do all the patients with for coronary bypass surgery on a beating heart, unless and until there is a reason to go on pump. I can proudly say that we have done so far in this hospital for the last 3 years almost 80 cases of bypass surgery, of which I would say 99% was off pump, so that the results were good. So I think that's the way we have to do it, because that's the way we can get around this virus problem and the inflammatory process. Next one. Yeah, I just wanted to, this is just to make you more comfortable. Look at the whole COVID process started in March. So this is how the Spider-Man look in March, and look what happened in August. So I think this is a picturization of what Dr. Gikoni has told. Sedentary life, good food, lack of exercise can make you like this. So I think the moral of the story is that you have to be active and control your food habits and avoid drinking, smoking, and all sort of things, so that you don't get into any of these risk factors. Next one, Duncan. Yeah. Just wanted to tell you once again, this is a study basically from Kenya. If you look very carefully, the risk factors, what Dr. Gikoni has told, once again, blood pressure, hypertension, diabetes, obesity, stress, smoking, physical inactivity. And so if you take all these risk factors, if you look at it, only 3% doesn't have any risk factors. Can you believe it? Of all the people, only 3% don't have a risk factors. If you take an age between 18 to 44, they have about 10% of the risk factor, which is three or more of these risk factors which you are talking. If you take the age of 45 to 69, the risk factor is about 26%. And I think the most important thing is that only about 10% are getting, of all the risk factor people, only remember, only 6 to 8% is getting real medical attention, drug therapy, and counseling. So I think what Dr. Gikonio, I'm just trying to assert the factor what Dr. Gikonio has told, that many of us are walking around with the risk factors, but we are not taking a qualified counseling or a doctor's opinion, so that we can nip it in the bud, before it becomes worse, or before the complications or the risk factors become a major issue for having a heart attack or any other heart problem. I think it's better to get it checked and fixed. I would say that anyone more than 50 years should have a yearly checkup, so that if there is anything, can be rectified. It is better to be safe than sorry. Next one, Duncan. Yeah, once again, I'm just showing another picture what Dr. Gikoni has shown. So this is if you cut a blood vessel in a normal fellow, this is how it looks. As you know, it has got three layers. I'm not telling what it is: outer, middle, and inner. And this is the lumen. See how neat and clean it is. So this is how a normal blood vessel look like, But as you know, when you have risk factors, when you slowly these sediments settle inside, and how the lumen become narrowed, and so the blood, you just think of like having a roadblock, so the blood can't flow well, so that the cells and the muscle beyond this does not get enough blood, and that's the time you get chest pain, and if it is more extensive, you get what is known as a heart attack, and so on and cardiogenic shock, all sort of problems. So I think if we can get before it becomes a major block, I think we have got good medicine, good investigative tool by which we can fix it. So, so I think the moral is that it is better to get it checked and fix it early enough. Even if it is blocked, if you come early, as Dr. Gikonio has told, the golden hour, we can use a balloon to clean it up and put a stent. Stent is nothing but a spring-like thing inside, so that the blood flow is ensured. So that is another. So when you have a problem at home, don't sit at home and ponder and think about it. Please get a professional help. We are next door neighbors. So anytime you come, we can do the investigation, the cath lab, what is known as an angiogram. And if there is a block, we can clean it up and put a stent. So I think that way the muscle beyond this block can be saved. Once it becomes injured, that is the time you say patient had a heart attack. You get the ECG changes and so on and so forth. So should take a medical help if you have a problem as early as possible. This is another diagram, just it's a different way of what Dr. Ikone has told. See, what I want to tell you is that if there is a very strong family history, father, mother, brother, close blood relatives having heart problem, remember the nidus, the seed for the problem starts well early in life, So don't think that you get heart problem only when you are 50, 60, or 70. Either the nidus, the seed is already germinating in very young age, before 10 years. So as the risk factors increases, the sedimentation, the blockage becomes increased. And what I want to tell you is that if you don't have a healthy lifestyle, if you have all the risk factors, this block can come as early as in the second decade, third decade, or fourth decade. But if you maintain a healthy life, good heating habits, do all the necessary things, you can push whatever is happening further down. You can, instead of fourth decade, you can push to fifth or sixth or seventh decade. So what I want to tell you is that don't have a wrong notion that this is a problem which can come only in elderly age, but the nidus for the problem starts well ahead of time. Just wanted to show you just a little bit of details what we did. Before 2015 and 16, the number of cases that we were doing in this is the surgical data and this is the cath lab data. So I'm just trying to touch upon this. 2015 and 16, the number of open heart surgeries in Karen was very less. Then 2017 onwards, it jumped. So it went to 127. Then last year, because we had a lot of problem with NHIF and insurance and all sort of problems, so we could not, even though the patients were there, we could not help them too much. Now, what I want to tell you is that after the COVID also, we did about 45 patients. So what I mean to say is that if you screen them well, take the proper precautions, it can be done. As you know, COVID is something we all know that it's going to stay. As one of the Korean people told, it is like your wife, it's going to stay with you. So you got to live with it. So this is the way it is. So I think we have to learn how to live with it and go about with it. So if you look at the cath lab again, once again, 2015 only 173 cases, 16 slightly more, 200. But from 2017 onwards, we had a very good jump. And I would say in 2019, it's right at the below, it's more than 520 or 530. I don't know. Yeah, it's something like that. So we are making, our graph is going up. I think the acceptability of the patients are much better. People started to realize that you don't have to go to South Africa or India to get medical treatment, advanced medical treatment. It can be got. You can get the same thing at almost the same price at Karen. So I think that's a message we see from the graph, both from the surgery as well as from I think the patient load is much more. Only thing I think it is the insurance and the NHIF, which is that stumbling block. Hopefully it will get settled. So what I want to tell you is that the virus has taught us few lessons. Let us leave this virus behind, take the lessons, forward. So always remember one thing, the Czechoslovakian proverb, they say that the misfortunes always come when you keep the door open, So I think we should keep the door shut so that the misfortunes don't come inside. Next one, this is on the lighter side. The doctor is prescribing the Superman that instead of flying, he should walk because the midriff is coming out. So thank you very much. I think there are 2 or 3 more people waiting, so I'm just cutting it short.
Thank you very much.
Thank you.
Thank you very much for that very good presentation. Especially when you say that people don't have to travel very far to have heart surgery.
Yes.
They can have it right here at the current hospital.
Yes.
With the same type of good results than they can get anywhere else in the world.
That's true.
I think that's a good parting shot for many of our listeners.
Yes.
We shall move on. We are going to ask one of our senior medical officers, Dr. Sakina, to lead us in the next session.
Hello, good evening, everyone. So my focus today is on the need for annual medical checkup and a focus on prevention of the modifiable risk factors for COVID-19. As you can see, there are several risk factors which predispose individuals to COVID-19, and these are mainly in the non-communicable diseases. So we have diabetes, cardiovascular disease, respiratory disease, cancer, obesity, smoking, alcohol, physical inactivity, and pollution. If you go through each and every one of them, you would be able to see that all of them are predisposing these individuals who are suffering from these diseases at a much higher rate than those who are not. If you look at diabetes, they're 3 times more likely to have severe symptoms of COVID-19, which is quite prevalent in our community. If you look at cardiovascular disease, high blood pressure, and other cardiovascular diseases also predispose individuals to a much higher rate of increased mortality from COVID-19. Cancer, which is also common in our community, we can see that these patients also suffered from COVID-19 more severely. Obesity, which is now becoming a real concern after all these months of lockdown and restrictions. Everyone has been concerned about obesity now, and we can see that now patients are becoming at increased risk of suffering from COVID-19. Physical inactivity also attributes to obesity and other medical conditions. Pollution, air pollution compromises lung function, which increases risk for respiratory infection, including COVID-19. So from this picture, we can see that everyone is stressed about COVID-19 and the non-communicable diseases. As we move on, we reflect on 2020 that health systems were unable to fully respond to the majority of countries, in the majority of the countries, and healthcare needs of people living with or affected by non-communicable diseases. So we need to reflect and build back a better tomorrow to include prevention, early diagnosis, screening, and appropriate treatment for the non-communicable diseases in essential health service centers, to develop systematic approaches to digital healthcare solutions, which do include webinars such as the one which we have organized. So from this picture, it's a timeline showing that how the COVID-19 pandemic and the non-communicable disease epidemic have brought about a deadly interplay. So we can see that there was not much focus on diagnosis, screening, and treatment for non-communicable diseases in the years beginning 2010. As we move on, we can see that there was a disruption of services for the prevention and treatment of these illnesses along the years of 2019 to 2020, which is during which the COVID pandemic is going on. So we can see that the world is at a critical juncture, and we need to build back and reflect on now what we need to do next. So we need prevention and control of the non-communicable diseases, which include cardiovascular diseases, cancers, chronic respiratory diseases, and diabetes, which are among the leading causes of death and disability, including overweight and obesity. So from this picture, we can see a few statistics which have been captured that, for example, in Italy, which was one of the countries which was severely affected by COVID-19, 68% had hypertension and 31% had type 2 diabetes. India, which has suffered quite a bit from COVID-19, reported that there were less cardiac emergencies, meaning that the facilities were not accessible. Netherlands, the number of people with cancer dropped by 25%. Again, the same reason was the lockdown. Spain, which had patients with severe COVID-19 disease, 43% had existing cardiovascular diseases. Well, everyone knows now what it means to put on a mask. Additionally, some of the restrictive measures, such as lockdown, social distancing, and travel restrictions, have reduced the spread of infection, but they have had an impact on patients with non-communicable diseases because it limits their activity, it limits their ability to secure healthy foods, it prevents access to health facilities. Physical distancing and quarantine has held to unhealthy diet, physical inactivity, increased tobacco use, and harmful use of alcohol. So we've seen that the chronic conditions have worsened over this duration, and it's increasing morbidity, disability, and avoidable mortality over time in non-communicable disease patients. This is just a breakdown from the research which was done to give us the factors of what has led to this disruption of services and how it has impacted the patients who are especially suffering from non-communicable diseases. This is just a brief outlook on what our targets are from Kenya. So this is a paper which was published. So our goal in 2025 is to reduce premature mortality due to non-communicable diseases by 25%, which include 9 targets, specifically focusing on tobacco use, physical inactivity, harmful use of alcohol, salt and sodium intake, raised blood pressure, diabetes and obesity, availability of essential medicines, and 50% of drug therapy to prevent heart attack and stroke. I think what we need to mention is the 0% target that we're trying to achieve with the diabetes and obesity. So that really puts a big burden on us on where we have to work. Yeah, that again on a light note, so we can see from the picture how the COVID-19 has impacted our health. So obesity, just wanted to point out that obesity for some people is, just an increased weight, and probably even some people would say that, yeah, she's a bit healthier and something, like that, such comments would be passed on. But if you look at it, there are 2 aspects of it. There's the biological aspect and the social aspect. So if you look at the biological aspect, the lungs are affected, there's increased stress on the heart, the immune response is less, and increased viral load. So you can see that from all of those factors, which lower socioeconomic status, poor diet, reduced activity, race and ethnicity, which predisposes us, we develop obesity. And from that, we come down to increased severity of COVID-19 infection. So 2021 is here. What are our New Year resolutions? If you have an underlying medical condition, you should continue to follow your treatment plan. Continue your medicines and don't change your treatment plan without talking to your healthcare provider. So we've actually even come across a few cases in the hospital whereby some patients who are on treatment for various medical conditions, especially diabetes, high blood pressure, were off their medicines for a couple of months and ended up even presenting with stroke at our emergency department. So have at least your 30-day supply. Do not delay getting emergency care for your underlying medical conditions because of COVID-19. So many patients tell us that they fear to come to the hospital, but our departments have infection prevention protocols, which we're following, and we make sure that we don't transmit infection for this reason. Call your healthcare provider if you have any concerns. So what do we have to offer as the Karen Hospital? We have annual wellness checkup programs, which we recommend once a year checkup for all our patients with high blood pressure, diabetes, cancer, and obesity. Of point is, these once a year checkups are for patients who are well. For those patients who have any symptoms or worsening conditions because of these underlying conditions, you should see your doctor more regularly. So these are the various packages which we have to offer, which focus mainly on the non-communicable diseases. As you can see down here, there's a specific checkup for the heart conditions, the diabetic checkup, there's a child health checkup, and various other packages which we have to offer. These are a bit more advanced, so they would include screening for cancer, for females, pap smears, mammograms, and also full cardiac evaluation, and as well as for males also. So they're actually programmed to target the females and males conditions separately. Yes, that is the end of my presentation. Thank you very much.
Good, Sakina. Good.
Thank you very much, Sakina. Thank you very much, Sakina. That was a very wonderful presentation, and I hope that our participants who are listening at the Borough community and the university and the hospital have had a good education from what we have said. Our final presentation is from Dr. Shango Rongo, who will tell us more about venous complications of circulation and how we can handle them. As you know that COVID also interferes with your coagulation. It causes generalized blood clots and even worsen varicose veins and the rest. And Dr. Irongo will take us through that. Welcome, Dr. Irongo.
Thank you, Dr. Gikonyo, for the introduction. My name is Dr. Shango Irungu. I'm one of the physicians at the current hospital, and I'll be talking about COVID-19 and blood clot formation or thrombus formation. That's my brief outline of what I'll be discussing today. I'll give a brief introduction, give a pathogenesis, a short explanation on how clots will come about and how they'll manifest themselves, especially in the setting of COVID-19, and how to evaluate, and just give an overview of the treatment. And then I'll also give an overview of venous insufficiency and what we are doing at the current hospital. So COVID-19 is an illness, disease caused by the novel virus, the SARS-CoV-2 virus that caused a cluster of pneumonia cases in Wuhan, China towards the end of 2019. And later it was declared a global pandemic in March 2020. So COVID-19 has a wide spectrum of presentation or manifestation. There are many patients who are asymptomatic. And then there are those who are symptomatic. And for those who are symptomatic, can either have mild disease, which is a majority of people, about 80%. There are those who come with severe disease where they have lung complications. They cannot breathe properly on their own and will need oxygen supplementation and therefore need to be in hospital. And there are those who are critical, who end up having multi-organ damage as a result of the illness. So the understanding of COVID-19 is evolving over time. There's new information every day. And now we are even discussing about the vaccine, the new vaccines that are being introduced into the market, but I won't focus on that discussion now. I'll just briefly talk about clot formation or thrombosis in the setting of COVID-19. So there's an increased risk of clot formation in patients, especially the severely ill, those who are hospitalized in the wards or in ICU. And how does that come about? What's the pathogenesis of that? There's a diagram there on the right that just summarizes the interplay of factors that are responsible for that clot formation. There's a triangle in the middle that shows the thrombosis or the blood clot. And the factors that come into play when that happens is in the different colored circles. There's an orange circle there that talks about vessel wall injury. COVID-19 is going to cause injury of the blood vessels, especially on the inner lining of these blood vessels. That predisposes you to forming a clot. The purple circle there causes hypercoagulability, where your blood is, to use a simpler word, thickened, because your coagulation factors are abnormal, and that predisposes you to forming a clot. And then the top circle there in green causes stasis. Stasis means where the blood flow is slowed down, and that would happen in severely ill or critically ill patients who are immobilized and are in bed most of the time. So when you have an interplay of all those factors, then you have the formation of the blood clot. All this triad is also known as Virchow's triad in medicine. So the manifestations of the thrombosis, especially in the setting of COVID-19, you can have clots in the veins where you have venous thromboembolism. You have clot formation within the deep veins, either in your lower limbs or upper limbs. You have clot formation in the pulmonary circulation, causing pulmonary embolism, and this is seen quite often in the severely ill or critically ill patients. You can have clot formation within the arteries as well, where these patients are at risk of getting stroke. That's clot formation within the blood vessels in the brain, where you have limb ischemia, where there is a blood clot formation in the arteries in either the the legs or in the upper limbs. And then you can have microvascular thrombosis, where you have small clot formation in the small blood vessels in various organs. And then one other manifestation that's also not very common is also bleeding, but this would happen especially in those patients who are on blood thinners. So how do we evaluate these patients who are suspected to have blood clots? There are lab investigations. That is where we do your full blood count or the hemogram, where we especially look at platelets. In the setting of COVID-19, we see your platelets have been affected. The other blood tests that include D-dimer, coagulation profile, and fibrinogen levels. I'll just mention, but not go into detail about those tests. And then now for those patients who are severely ill or critically ill, and you may need to look at the clots, especially in the legs or in the limbs. You do a Doppler venous ultrasound. And then for those patients who suspect to have a clot in the lungs, then you do a CT scan of the lungs and be able to get the details of the blood flow in the vessels in the lungs. When you have a combination of all these tests, you'll be able to make a diagnosis of blood clot formation, and depending on the organ involved. So I'll just touch on the various forms of treatment and prevention of blood clots in the setting of COVID-19. When it comes to treatment, we recommend we give blood thinners or anticoagulation, and as per the hospital protocols, and you give it at full dose. There are different blood thinners where you have heparin or warfarin or newer drugs or new anticoagulation agents. For those patients who have blood clots and have and they are severely ill, especially those who have massive clot formation in the lungs, or those who are about to have gangrene in their leg because of clot formation in the veins, or those who have a heart attack, there are special agents called thrombolytic agents for that treatment. I won't go into detail in that. There are also medications that we can use to prevent clot formation, the same blood thinners but at different doses, with the aim of preventing blood clot formation. But for patients who are severely ill, there are some who you determine to put on full dose anticoagulation, especially those who are at high risk, they're in ICU, or those who will require a surgical or have had a surgical operation, or patients who are pregnant. And this may require to continue the blood thinners as an outpatient. For patients who might encounter bleeding as a result of the medication, they are advised to discontinue the medication. And sometimes in the event that the bleeding is massive, there are agents to reverse the effect of the drug on the body. And for those who even get severe blood loss, they get anemia, or they lose a lot of platelets, they get thrombocytopenia. Depending on the severity, there's a role of blood transfusion in those patients. So that's the end about COVID-19 and blood clots. So I'll now talk about chronic venous insufficiency. This is a common problem that results from patients who've had blood clots for a long time, and then now subsequently they get venous insufficiency, which affects your lower limbs. And many times it presents as varicose veins. So there's a diagram there on my right showing veins at different stages. There's one vein, the picture in blue shows a blood vessel. That's a healthy vein with the valves in the middle. The valves are the ones that control the blood flow. But when you have venous or chronic venous disease or chronic venous insufficiency, where you have the valve is not able to control the blood flow. The blood flow is the red dots that are in the middle. So when you have that valve incompetence, in that scenario is when you have chronic venous insufficiency. And there are different ways that chronic venous insufficiency can present. And it's a whole spectrum. From my left, you can have the small spider veins and then progress to varicose veins on the extreme right. Progress to lower limb swelling with skin changes. You notice the skin becomes darker as you go down the leg. And in the worst case scenario, you have a wound formation at the lower part of the leg, or what you call venous ulcers. So that's a different spectrum of venous disease, or people commonly call them varicose veins. So how do we do our evaluation? This is so laboratory tests are usually not required, but what's the key important evaluation, the key test is actually doing a Doppler ultrasound to identify the veins that have reflux or the valve incompetence that would be causing these symptoms. And even as you're examining using the Doppler ultrasound, it would be also important to check the pulses of the other vessels, those are the arteries, and to determine whether you have arterial disease in the same setting. And you can do that using an ankle brachial index. So there are various ways we can manage venous insufficiency. For those patients who have mild disease, they are advised to do conservative therapy. That involves that we recommend that you do regular exercise and avoid prolonged standing, prolonged sitting, and for those who are at risk of, who have history of smoking or had history of thrombosis, to avoid prolonged standing, sitting, and ensure that they exercise. For those patients who have advanced disease, we're talking those patients who have leg swelling, who have chronic wounds that don't heal. There are different ways of treatment, and the most advanced or the current treatment that we are doing right now at the current hospital is doing endovenous ablation. I have a diagram here to a schema showing how this ablation is done. We have there a leg showing the blood vessels in blue. An ablation is a simple procedure, it's a minor procedure that we do here at the hospital. It involves putting a plastic tube into the affected vein, as you can see in the diagram there. Once the catheter is introduced, it produces heat, and that heat is what makes the vein to collapse. That's the whole principle of ablation. And this is another diagram showing the same. You put the plastic tube, that's a catheter, into the blue vein, and once it's inside, it produces heat, and the heat makes the vein collapse. And that way, that vessel that's causing the reflux will, with time, the symptoms in the lower limbs will also resolve. I think that's the end of the presentation.
Thank you very much, Dr. Shango, for the brilliant presentation on the relationship of blood clotting and COVID, and also how we manage varicose veins and other venous insufficiencies at the current hospital. We have been on this now for almost an hour. We still have participants still there, and I would suggest at this time that it's time now we answer some of the questions that have been asked. And I'll go to questions directly. The one that have come on our screen. One is what life changes can be made for someone with diabetes during this pandemic? And the answer is very easy. One is to have better control of diabetes. One has been very consistent in following up the doctor's recommendations in the way of medications. If you're on medicines that reduce blood sugar, you should adhere to what the doctor's dosages are. And if you're on insulin, also the same way. Diabetes control is also made much easier by increasing the physical exercise, because that way you reduce the blood sugar, get better control. Diet is an integral part of diabetes control, because we advise people with diabetes to avoid simple sugars and very high carbohydrate diet, and eat more vegetables and legumes like peas and beans, protein in quantities that will not cause increase in body weight. So yes, when one has diabetes, even in this epidemic, we can improve the sugar control by lifestyle, by observing diet, medications, exercise, and weight loss. Another question here that says, is 96.4 body temperature normal? Well, the answer that we have learned in school is that the average body temperature is about 98.4. And it can vary by almost 1 degree Fahrenheit from 97 to 99. That should be normal. But remember also, body temperature depends on where you are taking. If you are taking temperature in an exposed area that is exposed to cold, it can be less. If you are taking temperature in a body part that's exposed to the sun, it can also be higher. So it's a question of making sure that the body temperature is taken at a more representative part of the body, like the armpit or other areas. These days we have these gun temperatures that take temperatures using ultraviolet light. And if you are driving and your arm is outside in the sun, and the guard at the gate points the gun at your arm, it will record a higher temperature than if it's recorded from your face that's inside the car. And once you get that temperature that you are not happy with, it's always better to repeat it at a different part of your body. Another question, which is about cough, is having a cough throughout the year in any way related to any heart or lung problem? The simple answer is yes, because a chronic cough is not normal. But cough can be from various causes. It can be from allergies that are related to the lungs and airways, and that can occur quite regularly as long as the person is exposed to an allergen that is allergic to. Cough can also be a sign of heart failure because of congestion in the lungs, and the more congested the lungs are from heart failure, you can also have a chronic cough. Now, cough has also become a part and parcel of diagnosis of COVID from the lung involvement, and that is not throughout the year, because COVID does not run throughout the year. People who smoke cigarettes or cigars or who are in a smoky area, in areas of air pollution, may also have a chronic cough from irritation of the particles of smoke. Another question is, what do you say about teenagers? And I would say that teenagers and young people and children are the right age to start talking about lifestyle, because what we learn when we are young is what we keep when we are old. Many people who smoke cigarettes start either as teenagers or younger. Very few people start smoking as adults. Bad eating habits also are learned in childhood. The same thing with bad healthy lifestyles. Excess body weight is gained early. Bad eating habits, eating sweets and sugars and juices and the rest, is learned very early. And it is at this level of children, young children and teenagers that we should target to teach about healthy lifestyles. I will check if there's any other question on that. Does anybody have another question? There are other questions here about children, which I'll allow Dr. Sakina to have a go and answer some of them. Dr. Sakina, please welcome.
Yeah, so this question on the chat, children doing studies on phone creates vitamin D deficiency due to lack of time for outside activity in day. Also neck pain. Any solution to this? Okay, one point to note is that vitamin D deficiency in our setup is a bit rare because as much as the children are doing studies on phone, the vitamin D which we get just from even a short stroll outside, 5 minutes, 10 minutes is enough for us to not suffer from vitamin D deficiency. But of course, for children, we encourage them to spend more time outside so that they spend less time on their phones. Neck pain, I guess exercise is what we would advise for the children. So if they suffer from neck pain due to probably sitting in one position for long for their classes, after their classes, maybe they can take some time to go to do some exercises. This will improve their circulation and also improve their general well-being.
Thank you, Dr. Sakina. I'll also open to other panelists if they have any comments. Prem, do you have any comment on any of the questions or give a parting shot?
No, I would say that, I don't think we are going to eradicate COVID. I think we have to learn with it. It will be there. I think there is one other question. I think DK you didn't see.
Wait, Prem,
it's regarding the vaccine. When do you think vaccine will come to, Kenya? That's what one other question. So I think it should come probably next month. So I think in the days to come, my feeling is that we have to learn to live with this virus. Probably we'll have to take the vaccine, take our precautions, use the mask. Probably using the mask in the public place will become a common norm, which I've many times previously have seen, especially the Koreans and Japanese are known to use it well ahead of time. So I think it will become the norm of the day. And I think we have to go along with our life. I think that's the way it will be. I don't think we are going to eradicate it. So I think we have to live with it, and we have to take the precaution and then do it. So I think what I want to tell you to this community is that Karen Hospital is pretty well equipped. It's a multi-specialty hospital, as you know, but even though it's a heart and chest seems to is the strong point. I think we have got all the diagnostic tool and equipment and treatment modalities for all the problems. So I think don't hesitate to come. Don't hesitate to treat yourself. Take an expert opinion. And if you treat early, many things can be fixed in the early stage itself. I think it is, as I told earlier, it is better to be, safe rather than sorry. So that's a parting message I want to tell. So we are here to help with you. We are here to walk with you. So let us work together and make it a successful program. DK? DK, what is a parting message you want to give? I think all the questions has been answered, I think.
Thank you, Prem. Thank you for that answer. Dr. Shango, do you have any comment on that?
Yes. DK, someone want to know when will the vaccine come to Kenya? I think probably next month.
About the vaccine.
Yeah.
I think there are many vaccines that are undergoing trial right now. Even as we wait for the vaccine, we should, I think we should do our best in trying to prevent the spread of the virus. We don't know how long it will take for the vaccine to come or to be available in the country. But meanwhile, I think we should strive to find a way to prevent the virus, especially if you're in the community. And but in the event that you're affected, our gates are open and we are able to handle and take care of any issues arising.
Thank you, Dr. Shango. And as we come to the end, we've done most of the answers. And if there's any other questions, you can still forward them to us and we can answer them privately or generate to different groups. But allow me at this time to thank all the participants who have been able to take part in this group, especially the group from the Bora community. Abdul Sabir, I'm happy that you are there. Alexa Hamid, Alifia Palki, I can see you, thank you very much. Hatim Bashir, thank you very much for attending. We have Insia Tayabali and Khadija Kanchawala. I can see you and thank you very much for coming and for being part of this group. And I hope you have learned something that's useful. Let me thank Mariam Ragib and Mukaram Gojawala, Mutaza Shakir. I can see you. Thank you very much for attending. Nafisa Diwan, Mutaza Shakir, Nafisa Aliyakha. Oh, thank you very much also for being part of this group. I know we are many of us there. I don't forget Norman Ezi and Shabir Musaje, and also Zohia Abdusain. Thank you very much. And there are many of you, I may not mention all of us, but thank you very, very much for attending. And we hope that somehow you have benefited from this discussion. And we hope to have more cooperation and working together with your institution and our institution. Thank you very, very much.
Thank you. Thank you.
Bye.
Bye-bye.